Kirsty Broder. I'm a dentist and the owner of Kirsty Broder Aesthetics Limited here in Lady Bay in Nottingham. I've just sat down, it's kind of 8 o'clock in the evening, and I am just about to start some refresher training in medical emergencies. As a dentist, we are regulated by the General Dental Council, and part of that is that we have to do a certain number of hours of continued professional development, shortened to CPD, every year, and we have to do 100 years of CPD in a 5-year cycle. It has to be verified, we have to get a certificate for it, and we have to log those hours, and if requested, we have to submit that information to the General Dental Council as well. And this is really important because actually on Friday I did have a medical emergency, a minor medical emergency, thankfully, in the dental clinic. It's a relatively elderly lady. She has a relatively complicated medical history, and she started to feel a little bit woozy in my chair during treatment. She was conscious throughout, and we were talking to her and reassuring her. We did use the oxygen, and actually she used her GTN spray, which is a spray that we use when somebody has angina symptoms. Now, she recovered, she's fine. I followed up with her in the evening, and she was right as rain. But it just goes to show how important it is that we are trained to manage medical emergencies, both in the dental centre, and how important it is as an aesthetics practitioner. I work in a clinic on my own to be able to manage these complications for our patients as and when they arise, because they do arise. Sometimes people just start to feel a bit woozy, they start to feel a bit faint, all the way to the potential for somebody having a heart attack, or somebody having a hypoglycemic episode, or somebody suffering from epilepsy. And as a facial aesthetics practitioner with a medical background, I am trained and competent in order to deal with that as and when it arises in my clinic. I was on a training event relatively recently, and there was a non-medic who was training in aesthetics, facial aesthetics procedures, and her patient actually felt woozy, was looking like she was going to faint, but then actually was sick. And the injector, not medically trained, walked out, couldn't deal with the patient being sick. I stayed back, I helped, because that's what you do when you are responsible for your patient. So just wanted to highlight the point, really, of how important it is to be competent to deal with medical emergencies as and when they arrive, and that as a dentist I'm regulated by the General Dental Council to be responsible for your health and safety, particularly when you're in my hands. Cheerio for now.